So, congratulations and thank you for joining us.
Yeah, thank you so much, madam.
Now we can
And
see you.
you can see me?
Yes.
Okay, okay. And so, as you have mentioned, I just cleared my Part B from Colombo. And to be honest, I was also a bit tensed because Colombo was also a new center for us. Only the exam happened once in 2023. And before booking, I asked two or three members who appeared in Colombo, and frankly, it was a mixed opinion. Some said that it was good center. The examiners were good, and some also say that don't go for Colombo because we have bad experience there. So after some talking, I thought I should go for Colombo because I had faith that uh, all the centers were almost similar, and if I have good preparation, then I don't think centers will be any problem. So for this reason, I went for Colombo, and so now I'm just sharing my experiences from the exam day. And the exam center was in the National Hospital of Colombo, and it was a pretty big center, and the examiners were really friendly.
That's
And
good.
yes, they were very friendly, and the topics were almost similar to what we studied. It was nothing new, and if you can answer uh, anything straightforward, they will accept the answer. Except for one or two examiners, I thought that they were not really giving me the hint, or they were not very much cooperative, but the remaining 15 examiners out of the 17 were very much friendly with us.
That's nice.
And yes, and especially in the communication part, in the examination part, they observed us. And in the knowledge part, if I start with my session, I started with the pathology, and the two pathology stations were completely straightforward. They just asked the question, they showed the figure, and if they wanted something new, they would ask what else once or
Okay.
twice, and if they accepted the answer, they would nod or give a hint that yes, it's correct, but in a friendly manner, definitely in a friendly manner. And the pathology stations were straightforward. Then came the critical care. The critical care stations were also from what we studied previously. There was nothing new, and the question answer were straightforward. There were some critical care scenarios where examiner wanted more, and after I gave three or four more of the answers, they seemed to be satisfied, and I
That's
think
nice.
that was very cooperative. But in anatomy, I thought that there were one or two examiners that were not so much cooperative, and I think this can happen in any center. Uh, Regardless of whether it is Colombo or Kuala Lumpur, it can happen to any center. But regardless of this, the topics were very similar to what we study. The pictures are also similar, not exactly like the book, but it's similar and it's understandable. And then I had my examination. The examination in the examination, the patients were mostly actors. I had ankle examination, and the uh, patient cooperated with me very much. They were very much cooperative. And when I asked him something about whether to have any pain, can you do that movement? Can you do this movement? Can you sit up in the bed? They followed every bit of my command. I find it really amazing for the exam center. And after this, I had a break. No, sorry, not break. Then I had my procedure station, and the procedure stations were also straightforward. I had suturing and catheterization. It also went pretty good. And then after the break, we had the communication and the history stations. And the communication, as like as other centers, it had a preparation bay for about 10 minutes. And in the phone call, I had mastectomy, Dama mastectomy, and in the person-to-person communication, I had warfarin counseling for preoperative warfarin stoppage. And And in both of okay, in the phone call station, I think the examiner was not as expected. He wanted everything to be quick. In the last, in the first, when I wanted to summarize, he also didn't give me some time. So in this one station, I thought that the examiner could have been more cooperative with us. And this phone call was the problem with many of us candidates. And after the exam, we also complained of this phone call. And regardless of this, the other stations were good in the communication. There were 10 minutes time for preparation, and the patient or the actor was cooperative. Also in the history, when I started giving history, there were two histories, one for the IBD and another was anxious patient. Anxious patient, no, sorry, it's not anxious patient, it was pulmonary embolism. And in the IBD station, I remember it was a female patient. And when I started talking with the patient and I wanted to take the history, she said, no, I will not give you history. I want to talk to your consultant. So I understood that it was part of my exam. So I reassured her that since he's away from for an emergency and he told me to take the history, and I have done this several times. For this reason, I want to take the history. It will be for your own betterment. And after saying this, the patient said, okay, no problem, you can continue. And like this, the exam continued. And after the both the histories, the questions were almost similar. So, do you like to present your case? What are the positive findings do you get? What are the investigations you'd like to do? And a treatment, I don't think they asked about the treatment, only up to the investigations. So this is how my examination went.
What about the patient? Did you feel any problem with communication?
No, no,
Or
no.
it
They
was
were
easy
very
to
much good.
understand them?
No, no, no. Their accent were really good. And
Okay.
there was no problem in understanding. I can assure you
No,
that.
okay. Because Sri Lankans, their English is really good. So that
Really
is
good.
one thing,
Expected.
but it's just still some people think and feel they're hesitant. That's why I'm asking. So what about like how far was it from airport to the station to the local, you can say, where examination took place, the hospital? Was it too far away? Was it easy to go there and find the accommodation and you're
Oh,
convened?
yes, ma'am. So for the hotel, we booked the city hotel of Colombo, and it's near the World Trade Center.
Okay.
And it's uh, it's comfortable, and also the main advantage we had was it was pretty close to our exam center, like about 15 to 20 minutes from the exam center. The city
Walk,
hotel of Colombo,
by
yes.
walk. Okay.
No,
That's
no, no, not by work. No, no, no. We used the Uber, or they had something like
okay.
Pick Me or Uber. We use it, and the car arrived within 5 to 10 minutes, and it was like 15 minutes, very much near to our exam center.
That's nice.
And yes, but the hotel from the airport was far away. It was almost about 1 hour drive, 1 hour or
Okay.
more from the airport.
But
But outside the airport, there are very much possible ways for transport like Uber, taxi cab, large micro, everything is available. So we didn't have to go through much trouble.
that's good. Right. Anyone else have any question they want to ask?
Mahathir, congratulations, brother.
Thank you.
This
Thank you very much.
I'm going to appear in April, this 25 to 30 April in Colombo.
Okay.
The thing is, from how you book your hotel, this from booking.com or something else?
Booked my visa, booked
No,
my air
hotel.
ticket.
No,
Hotel.
hotel, your
Hotel,
residence.
I booked it. I remember I booked it from Agoda. From it was an app. It was not through any agency, just Agoda app. Just search the Agoda app in the Play Store. You'll get the app, and I think the Agoda app is very good for the Sri Lankan hotels.
Can you
I
write
have
the name in chat? The name of the
Yes,
app?
yes, no problem. Sure, I'll write it.
Thank you.
The other thing I want to ask, I have see some reels and some vlogs of the Pakistani people. They says this residence is very much expensive. What do you think?
Oh, actually, brother, I went along with four of my partners. All of us went together. So for this reason, I thought that the expenses were equally distributed, but I don't think it's quite expensive. It's just that their value is a bit lower currently. So, for example, the hotel that we stayed in, it had a rooftop hotel, and it cost about 990 Lankan rupees for bread and egg. 990 Lankan rupees. So that's pretty much expensive. But what we discovered that when we went downstairs and found many other local restaurants, then we could take food for pretty much low cost, and it is applicable for everything in Sri Lanka. You can have the microservice, the local microservice, and their cost is now low. As a result, the amount seems to be high, but I can tell you it's not that much expensive. The air ticket, yes, it is expensive, but other than this, I think in comparison to Kuala Lumpur, it's cheap.
Thank you, brother. Thank you.
And it would be far better if you can go with 4 or 5 friends at a time, so that wherever you go, everyone can share everything, and in that case the cost becomes almost half of the normal.
Brother, we are 2 friends. I am here in Saudi Arabia, and the other one who is coming from Singapore.
Okay.
So
No problem. In regards to Kuala Lumpur, it's cheap.
did the hotel provide transport, pick and drop from airport to the hotel, or no?
Actually, ma'am, as it was very near to our hotel, so we didn't ask anything about the hotel. But
No, from
I
airport.
don't think. From airport?
Yes.
No, from airport, no. The hotel didn't provide any transport.
Any pick and drop. Okay.
Because, ma'am, I have heard that airport is very far from this city center in this hospital in Colombo. Maybe 1 hour or 2 hour drive from airport.
Yes, it is almost about 1 hour and 30 minutes. But outside the airport, there are multiple systems you can go. For 2 person, they have small cars. For 4 or 5 people, they have microbus. So there are lots of ways you can go to your hotel, and there are lots of cars waiting for you outside the airport, and we didn't have to go through much hassle from the airport.
Thank you. So that's why, thank you, brother, because I was so much worried about this Colombo, because I have to fly to Colombo, how is the situation will be there. So by listening to you, thank you so much.
Yes, but I can understand that we had the same type of feeling before going to Sri Lanka, and we couldn't ask much because only the exam happened only once before us, and the negative comments were so many that we still were frightened. But I would say just focus on the exam and on the knowledge and examination parts, and on the practice. It will help more on the exam day, trust me.
Yes, the one thing you converted your currency into Sri Lankans, or you take with them, and then there is exchange services available at airport or outside in the market.
Okay, brother. I took the Lankan rupees from my country. The Lankan rupees from my country, as my father is also in the banking sector, so it was easy for me. But all my other partners, they exchanged the money in the airport.
Okay.
In the Lankan airport.
Okay.
Any question you people want to ask about the recalls or?
Yes, ma'am. Yes, ma'am. Mahathir, you have any previous recalls of like 2023, and then this I have written this suturing and catheterization. One and the others you must talk to me in warfarin. One is IBD and pulmonary embolism. But you didn't tell this about anatomy, patho in this examination.
Oh, in this examination anatomy, there were one station from the head neck part. Okay, so let me recall. In the head neck part, there were 3 or 4 pictures. One was about the thyroid and on the branches of the external carotid artery. And which branch is this? Is it the superior thyroid artery? Is it the inferior thyroid artery? If the inferior thyroid artery, will it cause any problem to the parathyroid gland? Like this, one picture was this, and from there he went to the branches of the aortic arch, and also it was mainly concentrated on the head. Okay, and there was one picture of the heart and also ligamentum arteriosum of the heart, and also so this in this station there were the heart, arch of the aorta branches, thyroid, and yeah, these 3 or 4 pictures and relevant questions. Okay, in another anatomy station, okay, in the next anatomy station there was the lower limb. In the lower limb there was the I remember it was the gluteus. She told me to identify, I think, the gluteus medius and the muscles of the back of the thigh. The muscles of the back of the thigh, that is the adductor magnus or something like this. I cannot recall right now. So it was more on the lower limb, and then from there she went to the popliteal fossa, and it was completely on the lower limb. And the last station was also from the no, not head and neck. It was from the brain-navel, and it was there was base of the skull, picture of the base of the skull, and also another question was asked. Okay, there was the question about the surface marking of the common carotid artery. At what level does it bifurcate? And from there, I think there was something on the last part that is the posterior cerebral artery. What will happen if the posterior cerebral artery gets damaged? And so yes, this was in the last station of the anatomy. It was mainly concentrated on the head on the brain navel. So one from the head neck, one from the brain navel, and one from the lower limb.
And what about pathology, brother?
Pathology. In the pathology, I had esophageal carcinoma. Esophageal carcinoma, all the common questions we have mostly, and in the another station there was the question on actinomycosis. From actinomycosis, I think he jumped onto the osteomyelitis.
Okay. And this examination was one ankle examination, the other was what?
Okay, in the examination, one was ankle examination, and the second one was CNS examination. And I can also tell you about the CNS examination. It was the first one, that is, she has problem with her, she has anosmia. So I think it was the first one, that is a pituitary tumor or something like this. That is, she has
anterior cranial fossa.
Anterior cranial fossa tumor. Yes, that is it. Yes. And in the last one, it was a chest examination. The patient was smoker and smoker for 10 years, and it was COPD.
Okay, okay, brother. Thank you so much. Thank you so much.
Thank you so much. Yes.
Mahathir, you have recalls of 2023 or not? The previous exam.
I have recalls, but I think I have to search it, or I can share you in the group, no problem. I have the recalls of Colombo 2023.
Okay, if you have, then kindly share it. Okay, thank you, brother, so much.
Okay, welcome. You're most welcome. I will share it in the group.
Okay,
Thank
brother.
you.
Okay.
Were there any unusual question or any question that you thought, okay, you didn't see it coming?
The stations were common, but there were 1 or 2 questions that were completely new to me. For example, in the pathology, in the actinomycosis, as actinomycosis is a short scenario, we don't have much recalls on actinomycosis. I had 1 or 2 questions that were new, and also in the anatomy, the part with the brain eyeball, and there were also 1 or 2 questions new. But one thing I can say that in if the questions are new, it's highest 2 or 3 questions, not more than that. Most of the questions you can answer with full confidence, but the 2 or 3 questions that seems to be confusing, and after the exam, when I asked my other colleagues those questions were also confusing to them. So I think after giving the exam, I think that the questions that are pretty common, we have to answer it with confidence and with surety. One or two questions will be new. I think it's their tradition that they will set one or two questions new. But in the examination or this history or communication phone call, I think there were not much of newer questions.
Good.
Okay,
Was
brother.
the
Thank you
time
so much.
enough for you to do the examination or history taking?
6 minutes.
Yes.
Yes, it was completely enough. And I think in the first station, pulmonary embolism, I just told the patient, so thank you for your cooperation. I'll go back to my consultant, I'll discuss him with the case, and then we'll come back again. And when I just said this, the bell rang. And in the IBD patient, I was in my last. That is, I needed 5 to 10 seconds more. In that moment, the bell rang, so I finished off quickly. So thank you for your cooperation, and then I finished. But 6 minutes is enough, and you can also, I notice you can also take notes, and also you can give the signpostings, and this 6 minutes, in my opinion, is enough.
Good. And I've already asked about the language barrier, so no
Yeah.
one faced any language problem.
No,
Anything,
no.
any other question you have, you want to ask?
No, ma'am, it's Alhamdulillah.
Right, good. Thank you. So
Thank you, brother.
Yes, you're welcome.
thank you for taking your time out and giving us your, sharing your success story with us.